Hello, everyone. Welcome to this panel about maternal health. I'm very excited to have the opportunity to be the moderator of this discussion. And I wouldn't do any of the panelists justice by introducing them, so I'm going to let them introduce each of themselves. So why don't we start first with Dr. Joia, then Helena, then Kristen.
Sure. So hello, and thank you so much, Binta, for having me, and to the National Minority Equality Forum. I always feel like home when I'm with you. So I'm Joia Crear. I'm an OBGYN by training and the founder and president of the National Birth Equity Collaborative. And we're about almost 6 years old now. And we work on Black infant and maternal health through policy, research, advocacy, and what we call culture shift, which is doing things like this, talking, ensuring that people don't continue to blame and shame Black birthing people for their outcomes, or really looking at the structures around racism, classism, and gender oppression that cause us to not be able to thrive. So thank you.
Hi, I'm Helena Andrews-Dyer. I am actually a senior culture reporter for the Washington Post. And I'm here because last summer that seems like a decade ago, I wrote a story called This Is Not Another Horror Story About Black Motherhood. It was a first-person reported piece about my journey during my second pregnancy, sort of trying to navigate the hopeful joys of motherhood while also being very aware of the statistics and creating a safe space for myself. So just here to talk about the story and how it came to be, and Black moms who I know are just creating the space for themselves where they are aware, obviously, of the numbers and what's going on, but also trying to find joy in motherhood.
Hey everyone, I'm trying to get this lighting together. So sorry if I'm like moving around, but I'm trying to make sure everyone can see me. I'm Kristen Rome. I'm a certified holistic doula practicing in New Orleans. I'm also a mama to a 2-year-old. And I am gonna hopefully talk a bit about my practice and my first profession, which I'll talk about as well, is I'm a criminal defense attorney, and I specifically do juvenile life without parole work. And so it's really interesting to be able to talk about how my birth work informs how I show up for my clients as a criminal defense attorney, and vice versa.
And I am Binta. I should have introduced myself more earlier. I'm a director of federal government affairs at AbbVie, but I'm really here in my capacity, and I'm honored to have been recognized as one of NMQF's 40 under 40 this year. And my background as a social epidemiologist focusing on disparities in health. And this is an urgent topic and an important one to discuss. So now each of the panelists will spend about 10 minutes talking about their issue. We're not going to take questions after each panelist. Please put your questions in the chat or the question box. And after everyone speaks, I'll go through the questions. Thank you. Dr. Joya, you're first.
Okay, great. So hi, like I mentioned, our organization is almost 6 years old. When we started, we really only had infant mortality in our mission, because most people focusing solely on babies as if the person around the baby is irrelevant, right? So for so long, our federal policy, our state and local policy, even our global policy has focused on infant health, which shows up in our maternal health outcomes as they are worsening and worsening, and we have not yet invested in women at all in this country, especially birthing people. And so it happens even when you deliver a baby, right? When the baby's born, everybody rushes over to the baby and mom is left behind. We throw away the wrapper. So it's important for us. We added maternal to our mission about 6 months in to our organization's founding, and we focus on and undoing the policies and practices and the research that has been harmful. So we work right now, our big strategies, we're working with the American College of OBGYN with some funding through the Robert Wood Johnson Foundation to really operationalize the respectful maternity care framework. It's a WHO framework that's been around for a little less than 10 years, and it's used in other countries. And there's not really any other high-income country that's been focused on respectful maternity care. We act as if having wealth makes you magically respectful, but being a Black woman in the United States, we are very clear that that is not a truth. And the same disrespect and abuse that happens to global anti-Blackness happens to us in the United States of America. So we interviewed Black birthing people across the United States this past year around what would respectful maternity care mean to them? How do you translate this kind of framework that's a global conversation because global anti-Blackness is real? How do you translate that into a high-income country like the United States? And they told us many things around what they wanted to see to have respectful maternity care. They want to be trusted. They want to be seen and valued. We have a lot of systems. I've been coming in NMQF for a long time and participating in a lot of research. And we talk a lot about trust building as providers, but we always mean them trusting us. We want them to trust that they can do research because we're not going to be mean anymore. We're going to want them to trust that they can come to the doctor because we're going to be kinder. But we never talk about how we should trust them. We should trust that they know their bodies better than we do. That just because you memorized all the blood vessels and tendons and ligaments in the body doesn't mean that you know every individual's body better than they do. The individual person will always have more information about their own bodies than we do. So it's important for us that my doorbell is now ringing. So I'm going to put y'all on mute and figure out what's happening in my home. Welcome to Zoom, COVID. Sorry about that. I'm going to check on this right quick.
Helena, why don't we go to you and then Dr. Joia can return afterwards.
Absolutely. So again, I'm Helena Andrews-Dyer. I'm a reporter with the Washington Post. And I just want to sort of start by reading some of the story that I wrote last year, which was like this big all-encompassing piece about sort of my journey during my second pregnancy. I'm a mother to 2 daughters, sort of navigating the numbers, as you will. And it starts this way. Tucked somewhere in the cluttered corner of a stranger's iPhone is evidence of my joy. In a 30-second video of me, it's a 30-second video of me milli rocking, 2-stepping in 3-inch heels and a black spandex dress chosen specifically for this moment. I've got to get this, I heard the woman next to me whisper as she turned her phone my way, and I kept on dancing like nobody was watching. At the time, I was 5 months pregnant, and I was having a time, child. Make that we were having a time. All 400 of us, an intentional tribe of Black moms, electric sliding to Before I Let Go in the lobby of the Renaissance Hotel in downtown Washington. Yes, people stared. Who were these women? So unafraid of their own happiness. Who were these women? So unapologetic about their womanhood, their motherhood, their Blackness. The answer, regular, degular, schmegular girls, as Cardi B would say, who wanted one day, a few hours really, just to be themselves. Without shrinking, without being the subject of the latest, often tragic news about the dangers of becoming a Black mother. We just spent our Saturday at the Mom Friends, a gathering of millennial mothers of color in its second year that feels as intimate as a family reunion, as celebratory as a 21st birthday, and as necessary as a therapy session. It was a bottle-popping escape from the onslaught of bad news about Black women in pregnancy that has permeated the headlines for the past 2 years. A timeline that unfortunately matches up perfectly with my own maternal health cycle, making my first birth feel like a trial by fire and my second pregnancy at 38, well, I'm still trying to figure that out. According to the media and a raft of dire stats, I should be prepping for battle, not bopping to Queen Bey. But it was impossible not to dance that spring night, not to feel giddy, significant, and finally willing to let go like the song said. Since 2017, Black women in their wombs have been trending. In her 2019 documentary, Homecoming, Beyonce, arguably one of the most visible yet private Black women on the planet, disclosed details of her extremely difficult second pregnancy with twins. I had high blood pressure. I developed toxemia, preeclampsia. The year before, another one of our patron saints, tennis great Serena Williams, revealed her mortality and recounted her harrowing birth story, which included an emergency C-section and doctors who she said ignored her as she pressed to get the CT scan that ultimately saved her life. This summer, Williams announced she's investing in an app, Mommy, with the aim of combating maternal mortality. This past June, while making the case for reparations at the congressional hearing, author Ta-Nehisi Coates repeated the devastating statistic: Black women die in childbirth at 4 times the rate of white women, as one example of a long line of proof in the continued legacy of slavery. The bad news is everywhere, as inescapable this summer as an Old Town Road remix, but not nearly as fun. Forget putting your feet up or sticking your head in the sand. That isn't an option for Black women, staring down a plus sign on a pregnancy test. These days, your pregnancy must be woke. 10 months filled with research and study and planning. As a Black woman, it's not enough to stay hydrated, take your prenatal vitamins, make your appointments, and curate the perfect nursery on Pinterest. There are studies to digest, articles forwarded by your best friend on C-section rates to read, summits to attend on combating implicit bias, and doctors to screen for implicit bias. It is exhausting work, and I needed a break. So that's the start of a much larger piece that I wrote. And I wrote it because, sort of piggybacking on what Dr. Joya was saying, we forget about the moms. You know, all of these stats, all this information is so necessary, right? And birth workers, and I'm sure Kristen and Dr. Joya can speak to this, have been ringing this bell about inequity for years and years and years. And it's, as a Black mom, I'm so happy and thankful that that work has been done, and that doctors are now paying attention, and that the larger public is paying attention, that legislators are paying attention. I'm sure we'll get into that as well today. But we're not thinking about the mental health of Black moms who now have to deal with this, right? On top of all of the stress of being pregnant, of being a mom, perhaps for the first time or second, third, whatever. You also feel like you need a doctorate, like you need to know all this information to save your own life. And that wasn't being discussed, I didn't feel, when I had pitched the story. And as an African-American reporter at the Washington Post, I felt it was necessary to make that story a part of this canon of stories that we've been getting about Black maternal mortality. And it's funny, in the pitch meeting about it, I gave everyone the numbers, and I said, what I'm going to do, I'm going to talk to as many moms as I can, just to ask them, like, how are you doing this? How are you navigating? How are you staying sane and healthy? How are you protecting your mental health during this time, knowing that you could die at the end of this, And so many of it was me and my editor, or the two Black women in the room, nobody else was. And people were just horrified by these numbers, right? And, my editor, my big editor at the time, she said, why is this? Why is this happening? And like, literally, I just looked at her, I was like, racism. I don't know how else to explain it to you. And so I want to dive into this and talk about how Black women specifically, are dealing with all of these, the culmination of all these issues, racism, sexism, all these things. And they were gung-ho, to huge credit to my paper, they were gung-ho immediately. They didn't see this as a niche story or as a story that wouldn't appeal to a large audience. This is a story that needs to be told. We need to talk about it. We need to give Black women this space. So I think in the end, what I found in the story was that we're sort of folding in on ourselves, right? And creating these sister circles, creating these close-knit groups that feed us, in a way, feed our mental health, feed our, need to feel listened to. I did it by making sure literally anyone who touched my pregnant body was a Black woman, right? And because I live in Washington, D.C., that was easy. I had the privilege of being able to do that. I didn't have just one Black OBGYN to pick from. I had literally almost a dozen, right? My doula was a Black woman. My chiropractor was a Black woman. And that was something that was incredibly important to me. I was like Issa Rae, rooting for everybody Black, because I felt like these women would protect me because they look like me. And even though I think, obviously they are part of this entire system and have their own implicit bias, I think constantly just going in and saying, listen, I know the numbers. I know this is an issue. I need you to make sure I'm safe, basically. And after my article came out, I think one of the great testaments to it, after my article came out, and I was doing like a postpartum visit with my OB, and she said, what, OBs, doctors, birth workers, we're not always thinking of how these numbers are affecting women, right? We tell you guys, to protect your mental health. We tell you that is a huge part of staying safe during pregnancy. And then we're telling you all these other, we're telling you all these doomsday statistics, but we have to think about how has the pendulum swung too far in one direction, and how to protect you in that way. And I wanted to bring that up with the article, and I hope it did. Yeah, and so I'm, here to talk about that. Any questions about that? And I think, crazily enough, obviously in these times, my suggestion would always to be find the support group, find those people, other pregnant moms, birth workers, all of that. We're in an insane time where that could be more difficult, but I have personally taken a lot of that to social media. I've got a running WhatsApp of moms that I can question on a constant basis, people that I follow on Instagram, Facebook groups that are, not the same obviously as meeting in person, but the community is there and the support is there.
Thank you, Helena. Dr. Joya, welcome back. You are in the midst of your remarks about how we know our bodies, and just look for you to continue.
Well, I mean, Helena's a great example of that. So thank you for sharing that beautiful story. I really appreciate you for sharing that with us. She made me think of so many other things to talk about, thinking about the need to have cultural congruence. So one of the things we fight for a lot at the National Birth Equity Collaborative is that people need providers who look like them, who come from their communities, who understand them. A key point is segregation worked really effectively. Many people do not know other people who don't look like them. They don't know those cultures. And so it's hard to have someone to value you if they've only seen people who look like you on TV and in movies, and we're gangsters and murderers, right? So this cultural narrative that we were broken has been so inundated. And so many people who are like me, physicians, many of them, my white colleagues, they don't know any Black folks. They don't have any one Black friend. They might have one or two, but how that really shows up in how they care for patients. And that's not to say there aren't some amazing ones. I mean, I actually know some Black doctors that aren't that great either. So I don't want to make this a ubiquitous, but there is a general tendency that, especially when it comes to birthing, which is a communal event, which is not the same thing as I need the brain tumor removed or I need my knee operated on, but having a baby has been done with midwifery for hundreds of years, since the beginning of time. It's in the Bible, for goodness sake. So this idea that we need to have some specialized surgeon to do it all the time, and it's very sterile and in an operating room, was created by white supremacy culture when we made obstetrics and gynecology at the turn of the century. So it's important for us to understand that birthing is a natural communal event. And so having someone from your community to be there with you is a good. It causes you to relax. It causes you to be seen and heard, and it's important. So that's why also having social support like a doula is really important, right? Because you need to have that feeling of community. And think about all the policies that are created to limit the number of people that can be in the room with you. Right now during COVID, I get to do a lot of research around telemedicine. And so many of the pushback that we're getting from providers is, we don't feel like we have protected time with our patients when it's like my doorbell rang, it's not protected, right? But patients have never been protected inside of our healthcare system. So now we're like on a more equal footing. This is what it feels like when we had to drive downtown, park, wait for hours to get an appointment for 10 minutes, where you don't allow me to bring my children, as if I have magical childcare that we won't pay for through our policymakers. And you make a policy that I can't bring my kids, and I can't have food in your office, and I have to be there for a certain amount of time. If I'm 10 minutes late, you cancel me. All those restrictive policies, when we don't have protected time and we have children and lives and families, only cause harm to Black birthing people, many birthing people across the country and across the world. And so undoing the core belief that we must control and plan when it comes to Black folks, and not allowing for us to have joy and justice and freedom. So creating policies that are around restriction and planning, and making sure that we have access to contraception and abortion, but not infertility treatments. Those are the kind of choices that show what you value about Black women, and what you're trying to do for Black birthing people is control and monitor, and not allow for us to have justice and freedom and joy. So I'm hopeful and optimistic as we go forward, we will create a space for reproductive and sexual well-being, where we recognize that hundreds of years of blaming and shaming people based upon their skin color was never an accurate depiction of what we should have been doing, and that we should have really been focusing on all of us have a right to thrive. All of us have a right and a capacity to live. And so how do we ensure that if you, just like you want access to abortion and contraception, we cover infertility, right? That people who are poor, just being wealthy doesn't mean you're going to be a good parent. I know some rich folks who shouldn't be anybody's mama, but yet we privilege wealth as some kind of indicator of good parenting. And we have no data to support that those two things go hand in hand. And really thinking about how you can use the levers of the federal government, and many of you who work with policymakers on the Hill, to think through how does the pharmaceutical industry? How does the policymakers at a state and local level, how does this overinvestment in things and items like breast pumps instead of lactation support individuals, right? Like, how do we really undo this belief that we should not invest in actual human beings and their ability and capacity to grow and to thrive? So.
Thank you so much. There are numerous times I want to just do this, but I'll do it. And now, Kristen, welcome hearing from you.
Thank you. Thank you. Yeah. Good thing I was on mute because I was all like, yes, yes, while Dr. Joya was speaking. So I guess where I will start off is how I got into birth work. So the reason why I ended up training to become a doula is because I knew I wanted to have a baby. And I was entering a phase in my life. I was in my 30s and I said, I really want to have a baby soon. And they are out here killing us. And so I got to figure out what it means to have a baby. And, like, I didn't want to just hire a doula. I wanted to know what a doula did. And so I took the training and I walked away from it recognizing that we are birthing mothers. Like, as Dr. Joya was saying at the beginning, that like there was this emphasis on babies. That's where I was. But once I finished this training, and I took a couple trainings. So like as I developed and I learned and I researched and I read, I recognized that we aren't just birthing babies, we're birthing mothers. And the way all of us walk through life has a lot to do with how we were mothered and how our mothers showed up for us. And so in going through this journey on becoming a birth worker and getting clients and reading more and taking different trainings, I was simultaneously doing juvenile life without parole work. And so my client population are children who committed murders when they were children and who were subsequently sentenced to life without parole in adult prisons. And in Louisiana, life without parole means that. It means you die in prison. So they were sentenced for these things that happened when they were children, and they were never going to have a chance to see the light of day again. And so as a part of that work, we focus a lot on adolescent brain development. And in doing that work, we also research our clients' lives. We do what's called mitigation investigation. And in that work, we not only look at our clients' lives, we look at their mothers' lives, their fathers' lives, their grandparents' lives. And what I ended up finding that was very common is that almost all of my clients either had poor relationships with their mothers, or their mothers had spent their entire lives navigating lots of different traumas. And so that started to inform my birth work, because I recognized that the way we birth is the way we parent, the way we mother. So if, like Helena was saying, I too felt very strongly that I need a Black midwife, I need a Black doula. I only want Black women touching me. And so as a mom now, not as a birth worker, but as a mother, having that experience and being able to have that communal support and go back to what we know was intended for us when we were created, just shifted everything for me. It let me know that I can make things happen the way I want them to happen, and I can have joy, and I can have peace, and I can create community and all of these things for myself. And so I take that into my birth work, and recognizing that when we help mothers recognize that they are supported in that most important transition in their life, when they are welcoming a new spirit into this society, into this environment, into this world, and that they are loved and supported, it shifts everything. It shifts entire families. It heals trauma for generations back and generations forward. And we as a people begin to shift when mamas begin to shift, when babies are birthed in love. And so that's kind of where my work has been. And I do a lot of, in my practice, studying and reading about the grand midwives, like Margaret Charles in Alabama, and recognizing that these women were catching babies and not losing mamas. And they didn't have a million medical equipments and machines and all of these things. But what they did have was this communal support that Dr. Joya is talking about. This just very innate thing that all animals have when we birth, that we are allowed to be free, we are allowed to feel and understand our bodies and know what our bodies need to allow our babies to come through, and we're not interrupted. So yeah, that's kind of been where I am. And so now, while it's hugely important to me that we are supporting moms to make sure that our moms are mothering correctly, I also really recognize that the way we are born affects, how we move individually through life. So not only the way that we are mothered, but the birth experience that we had. Because be very clear, if the mom has a traumatic birth experience, the baby had a traumatic birth experience. And so we are literally bringing people into the world with trauma. We are starting them off with trauma from newborns. And so there's no wonder why at 12, 13, 14, 15 years old, they're becoming my clients. Because from when they are born, we are setting them up to experience trauma. And so the only way that we can eradicate these systems that oppress us, all of them, including the prison industrial complex, is to begin with the hospital industrial complex and understand that people are more important and our families are more important than all of this money that Dr. Joy was talking about, everything we are investing all over the place. And also recognizing that as we're all talking about, that we all deserve to have that experience of being able to have autonomy over our bodies, and just the way that then bleeds into all of our life and the way we make decisions across the board.
Thank you so much to all of you. It's been just wonderful hearing you. And it resonates so much as a mom of two, my own birthing experience. I invite everyone to use the question box at the bottom if you have any questions. There aren't any there now, but I have plenty to get us started. Which one to ask first? I guess the one I'll ask now, which is more about the policy realm. And without really getting too specific, I actually am interested in keeping kind of broad. There's a number of policies that are out there, and increasingly you're hearing policymakers who maybe 5 years ago never talked about maternal health, let alone Black maternal health. And now that's an issue, and I think there's a lot that can be leveraged in that. And Congresswoman Robin Kelly has introduced the Moms Act. My question to you guys, if you're interested in speaking to this subject, is what do you look for in a bill? Like, what is something when you hear a policy of like, this is what I'm looking for? I know there's probably a million things, but like, what's something that's like, this is what I want to see in a bill if we're aiming to address and tackle and empower women of color in the birthing experience?
Well, we know this through this COVID moment for sure, that the lack of data disaggregated by race is killing us. And that we have to really push for policymakers to invest in the infrastructure to ensure that we can get data based upon race, not so that we can blame and shame people, but so that the resources can go to the places that actually need them. If the bias is the reason that people are dying from COVID-19 is that they travel to China or to Italy, then you see what happened in New York City, where in the original, without having any data by race, the assumption was, oh, it must be just people who travel, so you have to have a passport. Forgetting that Black and brown people change the beds for those folks who have passports, cook the food for the folks who have passports, and the virus doesn't care that if you have a passport or not. So many of Black and brown people died because we didn't have data disaggregated by race. That same thing happens for maternal health. And I love when people say policymakers now are listening, because that's what we fought for. It's not by accident that you hear Black maternal health everywhere. This was a strategy. This is an organizing strategy. Once we found out that Black women, that the Amnesty International and the world was calling out the United States for the fact that Black birthing people were dying, and that there was a declaration from the UN holding the United States accountable, we said, we got to seize this moment. We can't allow for them to once again blame us and shame us. How are we going to shape this narrative? How are we going to work with people at Washington Post, the New York Times? And I don't want us to ever forget that you kind of push policymakers through understanding an agenda that says we want freedom and justice globally. So we're looking for data, looking for investment. I also look for, when they send me any of these things to review, to sign on, if they actually have people from the community that help create it. I mean, the Momnibus, we started from just grassroots orgs building it. That's the kind of policy we want. We don't want somebody that's sitting in a firm that's never even talked to or worked with and doesn't understand that, as Ms. Rome said, that birth is the revolution, right? Like that's what we want. We want those people to be creating our policies. So I look for who did you talk to when you were creating this? Who did you get information from to know that this is the right policy for people who look like me and my children? And so those are critical things for me.
Does anyone else want to speak to that?
I would just say, and because Dr. Joya mentioned the Momnibus, and I actually spoke to Representative Underwood for the story that I wrote. And one thing I think that your original question is kind of like what you look for in this sort of legislation. And one thing that really stuck out at me that she said to me when we were talking about, she said, there's nothing pathological about being a Black pregnant woman, right? It's not you that's the problem. It is not your body. It is not you not being able to do this. It is being a Black woman in America. That is what is killing us, right? So in any of this policy, in any of the legislation, what we're looking for is to solve that, right? Solve the America part, not me, but what America is doing to me, right? To get these sorts of outcomes, and women who look like me to get these sorts of dire outcomes. So I think, in a lot of these bills we're continuing to see, and because of the work of Dr. Joya and her institution, is that, expanding coverage for a year, right? Because the postpartum period is not just 2 months, not just right after you had a baby, it's an entire year. The implicit bias training that Senator Harris pushed, it just something that is addressing the America part, right? Getting it together, not me. I don't need to get together. Like my body is doing what it's supposed to do, as Kristen pointed out, but just tackling this larger system, which seems like a beast. And it seems like something, I remember asking like, okay, so we have to solve racism. That's what's going to get us through this. And honestly, yes. And so it's just, that is what we have to figure out. And so the points in the bill that point towards that and recognize that and know that that is the bigger problem.
I think the issue that we always run into when we talk about legislation for women's health is this interesting balance of like using the government for what it can do and also telling the government, leave me alone. And let me do what I want to do. And so I look for less restriction. Women need options. I didn't say this, but I had a home birth because I, through my work, through my research, I did not feel safe going to a hospital. And I tell the women that I work with, I am certainly an advocate for women to birth at home, but if I tell the women I work with, the goal is for you to birth without fear. So if you're scared to birth at home, birth in the hospital. If you feel safe in the hospital, birth in the hospital. We'll help you make it the safe space that you want. But I gave that example because one of the things that I ran into, and I'm a so-called educated Black woman, and I have resources and all of these things, and I ran into huge difficulties trying to get my child a birth certificate because the state of Louisiana did not like that I had my baby at home. And they were like, well, who delivered your baby? Well, then if your mom was there, she needs to sign an affidavit saying she delivered the baby. She didn't deliver the baby, so she can't sign an affidavit. I delivered my own baby. Like this is, and I want to be very clear that I had help and I had a midwifery consultant. So I'm not at all saying that we should be willy-nilly having babies at home because this is what they always did, because be very clear, there was always a midwife on the block. So I'm not saying that. And I did have prenatal care with an OB parallel to my midwifery care, but I'm saying that the point that I'm trying to get at is that there are so many restrictions and there are so many reporting requirements and there's so many this and that. And so if we could have legislation that just makes it easy for us to birth in the way that we want to birth, and that essentially asking the government to create something that allows the government to leave us alone. And so that's just the issue we run into in terms of birth control, in terms of abortions, and all of these things. We're always trying to lift restrictions.
Can I just respond just for a second? Is that okay? Yeah, because I used to support the home birth midwives when I would practice in New Orleans. And part of the reason, the fear, the desire for control is so deeply laden into your experience. The desire to police and monitor where people are doing things, the desire to say, you can't have a baby the way you want. And I was recently watching, because we're all stuck at home, and watching with my 9-year-old all these movies, and this idea that you can control things before they happen, so that'll be better for people that you don't think have self-efficacy. It's seen throughout a lot of movie lines, right? So this idea that the job of policymakers is to protect you from yourself, because we know better. So we're protecting you from home birth because we know better. Meanwhile, they know nothing about home birth. They know nothing about any of these things. So anytime that you're trying to do a rule to protect someone that you haven't even talked to, that you've not even engaged with, that you know nothing about. And I totally agree that the goal is to birth without fear. And so for many people, we've always been overrepresented in home birth, Black people have, because we have always feared the hospital. COVID is now making it, well, white women, rich white women are now starting to have home births. And so now we're reimagining what that means, and how can we build a system that they have in other countries that have better outcomes than us. It shouldn't take a pandemic for us to value people's ability to birth without fear, and to be seen as fully human, and to be able to make whatever choice they want. I, have babies in hospitals and believe, that I'm an OBGYN, but I also believe people should get to do what they want. And they should be able to feel free and happy and joyful in whatever their choices are. And we should support them in their well-being.
You guys have touched in different ways on the fact that the birthing experience is communal, and that part of that community is providers and caregivers such as doulas and midwives, who used to be foundational to the experience and then have been shut out in many places in the United States as part of that. But now it's kind of a privilege for many people to have access to that. So I'd really appreciate you guys speaking to that, and the value and the strengths that they bring to the birthing experience, particularly for Black women and women of color.
So I'll start with this one. So it's been beautiful. Like, it's been beautiful to be able to welcome babies, like to have that privilege to stand with mamas, stand with families as they welcome babies. And I can give you an example of like what this means, what it seems to mean to families. I had a mom that a couple that I was working with a couple months ago during COVID, and I couldn't go into the hospital. And so we were, and this was like at the very beginning, where we were all like, well, most of us, I guess, like scared to death to go around anybody that didn't live in the house with us. And so all of my prenatals were actually via Zoom. And so then she had her baby and I couldn't go, and I felt terrible that I couldn't be there. And I just felt like, what use was I? And she called me afterwards, she and her husband, and they were like, I don't think we could have done this without you. And I was like, what? I wasn't even there. And they were like, you just gave us, so the part of the having that community is families start to feel, when families feel supported, they are empowered. And they feel like, I can ask questions because someone else supports me. Someone else believes me. I have backup. I have people there with me. It's just like, when you like in elementary school and you're like, I'm gonna call my sister because like, we going together. Like, that's the energy that you get when you have a doula. It's like, I got my doula. You want me to call her? You know what I'm saying? And it's not that we're gonna threaten the OBs or we're gonna say anything, because we don't say anything. We just hold space and we provide information and we help moms understand and families understand that you can ask questions. This is your body. You can refuse things. And so I think, if we start to understand it in terms of like the way we love to have our family support for anything else, anything big that you have in your life, if you're graduating, all the family wants to be there, and it means something to you. And so it's that same kinds of feeling and support that really helps moms. It's truly beautiful.
Yeah, and I'll just talk a little bit about midwifery, because as an OBGYN, I used to get in trouble. I would get written up for acting too much, listening to the nurses too much. And I always think, well, if you think I'm listening to them too much, what are y'all? Y'all don't listen to them at all, clearly, because they've been here with the patients all day and we've been in the office. So I don't understand this dynamic of not valuing women's voices. But the history of midwifery in this country is also the history of racism, in the sense that I was on a panel last year with a white woman who's over a large midwifery school here in the United States. And she said midwifery was started in Kentucky, right? So we know, like I said, midwifery is biblical. It's been around a long, long time, but granny midwives, Black women were birthing America for many generations. And when we moved to industrializing and making medicine into a medical industrial complex, like the prison industrial complex, we then said we got rid of and decimated granny midwifery. The Flexner report said they were dirty, they were not washing their hands, they were not rehabable, and turned many people who were birthing America were no longer able to do that. And by harming and the racism that caused the end of granny midwifery caused the end of midwifery. So every time there's an attempt to harm Black folks, it just harms everybody, right? So now we can't be like every other wealthy country that has a robust midwifery community, because we have not resolved our original racism sin. We have not agreed that we have to invest in undoing and apologizing for blaming and shaming people who actually birthed America, and saying that you don't have to be, midwifery does not mean a white woman with a PhD who's operating under a physician in a hospital. That's not what midwifery is. And until we can undo that belief and really invest in our ability to thrive across the spectrum, we're not going to be able to thrive as a country.
Wonderful. I'm going to read a question just to make sure I do it justice. Kristen, I am so glad to hear you say that a lot of women have mama issues. While doing maternal interviews with moms with losses, I hear that a lot. We need to work to get to the root of that problem and resolve that. What are some things that you all are doing to help remedy that issue?
Thank you. So I don't know. Hi.
Hi.
You like the babies too.
He's like, Daddy won't let me interrupt him, but I can interrupt you.
So I don't want to, I'm going to reject that notion that, and if I said this, I didn't want to say it. I don't think a lot of us have mama issues. I don't want to say that. What I meant to say was that I think that our relationships with our mothers can create beauty and it can create devastation. And so the way I think that we remedy that is we have to start focusing on how women birth, how mamas are birthing their babies. Because I guess the best way to put it is just to put it plainly, honestly, is that if I'm a birthing mama and I have an awful, traumatic, terrible birth experience, while I can love my baby, and I likely will love my baby, I am going to be affected by that. And the way I hold my baby, the way I look at my baby, the way I breastfeed my baby, whether I breastfeed my baby, all is impacted by how I am treated when I am birthing my baby. And so if we want mothers to be able to provide babies with safety and security and love and peace, we have to make sure that the mamas themselves feel safety and security and love and peace. And so I think the way we combat that is by having conversations like this. I think another way that we combat that is that I am really an advocate for, I started this by saying the way I started my journey was I wanted to be a doula for myself. So and I did hire a doula. I wasn't my own doula, but I wanted to learn it for myself. And so I encourage people who don't want to be doulas, but have other women in their families. You have a niece, you have a daughter, you have a cousin that's of childbearing age. Well, maybe you should take a doula training. You should read some of those books that are out there about birth partners and spiritual midwifery and all of these things, because doulas are not new. You know what I'm saying? Like the term doula is new, but mamas never birthed alone. We never birthed alone. We always birthed with a sister. You know what I'm saying? And the other thing that I wanted to say when Dr. Joya was speaking that came to my mind is that people like to say that the oldest profession is sex work. And to that, I say, if people were having sex, they were having babies. And so midwife, the work of midwifery is just as old. And so that is likely the oldest profession. And so there's no way possible midwifery was invented in Kentucky. We were definitely midwives were catching babies on the continent before they, stripped us and brought us over here. And so, I just want to be, I think that to answer your question, I think that's how we combat it. We begin to recognize that conception, pregnancy, and childbirth are sacred times. They are when God itself is embodied in the woman. And so if you have a spiritual practice, if you believe in God, if you know that the universe exists, then you have to we got to start showing reverence to pregnant people. We have to, and we have to respect them as much as we respect their divine beings. We have to treat them as such.
And thank you. That was beautiful. I just want to clarify why they think it started in Kentucky. Kentucky is where they started the nurse midwifery public health service. And
Thank you for that.
Rural Appalachian, we're going to fix birthing with having rural white women learn midwifery, as if it hadn't been happening for thousands of years before then. So that's really the erasure of Blackness and the erasure of the contributions that people of color around the globe have done, contribute to all of our ability to thrive is another reason why we're not able to thrive. Like, we should be able to see beauty in all of us and beauty in all the things that we've all created.
And I would just add, I mean, on the idea that like what we're doing, right, to combat the issue, and I think part of it is just mothering each other as well, right? So all that goes back to these support groups and knowing, I think that one of the issues that I knew that I would have in being pregnant and birthing is that I'm in DC alone. I'm not from DC, I'm from Los Angeles. My mother lives in the US Virgin Islands. So I knew that I needed to create a mothering community for myself, and my doula was a huge part of that. And I also want to make a point I wanted to make earlier about doulas. I think a lot of as Dr. Joya and Kristen have talked about, this idea that Black women aren't doulas or midwives, or we're not there for each other, or doulas are something that white women do, right? That they're prohibitively expensive. That's not true. They can be, and they can be quite affordable. It depends on the research that you're doing and the doula that you're choosing. And on top of that, it isn't an either or scenario, right? I had both my babies in a hospital, and I also had a doula. Because I had placenta previa for my second pregnancy, I had a scheduled C-section. I still had a doula there with me, right? And she held my hand, explained to me every single thing that was going to happen until they wheeled me into that operating room. And we still needed her there. It's not, I think too often we think that folks who want doulas are midwives or home births are crunchy and hippies, and they don't want traditional medical care. And that's not necessarily true. And those things can go hand in hand. When I found out that I was going to have a scheduled C-section, I thought to myself, I spoke to Carolyn, my doula, and I said, one, I could talk it through with her and understand what my doctors were telling me. They've been telling me for months, okay, you have low-lying placenta, this might be an issue. And I felt like they were pushing it on me, right? But in discussing it with her, she helped me understand that decision and the decision that we eventually made. And again, like I say, she was there, even though she wasn't there watching and doulas don't, I think there's also this idea that people don't understand the difference between doulas and midwives, right? Doulas are there to hold your hand and support you. A midwife can actually birth a baby. Doulas are not birthing your baby. And she was there to support me. And I think that, especially as we talk about this hospital industrial complex, and the first time most women even have even been in a hospital for a ton of time is when they have a baby, and they don't understand it. All the things that are coming at you, don't understand it. I remember my doula telling me, explaining to me when I'd never been in an operating room before, obviously, like, you know, and she'd said, like, here's what's going to happen. It's going to be very bright. There will be a bunch of medical equipment around. You'll hear a lot of talking. It might be very loud. Here's how to center yourself. Here's how to calm down. And then she looked at my husband and was like, here's what you're supposed to do, X, Y, and Z, right? And that was invaluable. So I just wanted to make that point that it's not an either or situation. You can have both.
I'm sorry, I know we're almost out of time. I just saw in the chat about the, it is not only just the birthing experience, it's the entire, being a woman, being a Black woman in the United States of America or anywhere around the globe impacts our experience. So yes, we need to be seen and loved, whether we ever decide to have a child or not, during the entire prenatal care and pregnancy or not, if we decide to surrogate or be an auntie or not, right? Like we deserve all of those things. And so all of those things play out in our birthing outcomes because we're not seen as fully being able to do it, to have joy and justice in any of those spaces.
So we have 5 more minutes to close. And I have one more question. I'm just gonna ask the panelists to be cognizant of the time. This has really been a theme that has been throughout the conversation, definitely your article, Helena, is I just appreciate if you guys could like share in the midst of, we see the statistics and people trying to define Black bodies and something flawed, but you guys throughout have really centered joy and empowerment and beauty. And I really appreciate hearing from you guys as you're talking to the audience here and Black women, women of color. How do they center that joy? How do they capture it when they may be seeing those stats and seeing that news stream and have family members who think they're being helpful, but actually really, really stressing them out, to really return to that feeling powerful and that there's joy in this experience and how important that will be in their experience and outcomes?
Well, I think for me, it was just turning inward. You know, you're getting so many things coming at you, so much noise, and we're in that world now, right? Where it's just like constant information flowing your way. And there were times where you have to take a break, and that is okay, right? It is okay to take a break from reading every single article about maternal mortality, you know, or following all the legislation about it. Or even in popular culture. I mean, there was a episode of The Resident about this, you know, like it's happening and it's coming at you from so many different streams of content that sometimes it's okay to take a break from it, right? And it being literally the outside world and really turning inward to yourself, your partner. And as you said, Binta, I like pointing that out. Sometimes family can really stress you out, right? Especially if you're saying something like, I want a home birth, and maybe your auntie is like, girl, don't do that, you know? You know what's good for you and you know what's good for your body. And to find, there are so many support groups that are online now on social media, on Instagram, Facebook, and Twitter, that are centering us, right? That are centering our experience, Matter Mia, Black Mamas Matter, you know, all of that are centering our experience, and really go there to find your community and those who can feed you and feed your soul. In the article, I went all the way to Brooklyn to meet with Latham Thomas, who is a doula and, you know, a birth worker in this space, who I actually went to college with. And I emailed her, I was like, Latham, I'm pregnant, like for the second time. I think I have to have the C-section. Like, I'm super stressed out. She was like, listen, come, we're going to do some yoga and meditation. You know, I'm going to get my healing crystals out and it's going to be a moment. And I took a train from Washington, D.C. to Brooklyn to do that. And it was so healing and helpful to me. And I knew I needed it. And that that moment was just as important for me as going to a prenatal appointment. So it's really centering yourself.
So we have about 1 more minute. So I'll defer to either Dr. Joya or Kristen to answer.
Oh, she said, so I just would say that there's a lot of people out here fighting for you. And so there are a lot of people like Kristen and Helena and I who are really fighting for you. So look for spaces where you are seen with joy and justice.
Thank you so much, everyone. This conversation will be available by NMQF for a couple of weeks, I understand. And I have really learned so much and really enjoyed. This has been just I've really enjoyed and appreciated this conversation, hearing about the amazing work you guys are doing. So thank you very much.
Thank you. Thank you for your work.
Thank you.
Thank you.
All right, bye everyone.